Hey, everybody, you've got the right therapist here, Nicole Kaufman, coming at you this week with some huge medical news. Gosh, we've had some real bombshells this week about a couple of things. One, the Alzheimer's study. Oh my gosh, right? How much of that literature and research was falsified? We are now 15 years behind in research for Alzheimer's because the plaque and everything that they said was the cause of Alzheimer's, now we know that that wasn't true. Oh my gosh. So that was a huge bombshell this week. And also another bombshell that really hit close to home for me was about depression medication and what we've thought since, gosh, about the 90s as far as antidepressants goes. So the word on the street has always been, right, the kind of layman's view about depression was, and about, studies show about 90% of people think this, is that depression itself is a chemical imbalance in the brain. And that because you have a low amount of chemical called serotonin is basically a feel-good hormone, and it is in the same kind of hormone class as another hormone called dopamine that makes you feel good and helps you manage pain. These folks have been telling us for years that depression is caused by a lack of serotonin. So a class of drugs has been manufactured to address that, and they are called SSRIs, and that stands for selective serotonin reuptake inhibitors. And so basically what it's designed to do is keep serotonin kind of actively working in your brain for a longer period of time so that it makes you feel better. Okay, so these SSRIs are like, you know, the popular drugs that we know about, Prozac and Lexapro, and I think Wellbutrin is another one, and Effexor, and all of these class of drugs that are designed to treat depression. And so this study showed, and I want to adequately cite it for you, that these drugs really don't have the effect that we thought they did. And here's the thing, y'all, 1 in 6 people is on these kinds of drugs. We have a major epidemic of depression and antidepressant use in this country. And I want to get into that a little bit today to talk about why that's happening and how that's happening and what is the kind of public view on what these pills are supposed to do to us or do for us. And then I also want to talk about how, from a clinical perspective, how I see this. Now, this is my opinion. I am a therapist. I am not a psychiatrist, nor am I an MD, full disclosure. So I want to talk about what I see that and what that means and what long-term, how I see that affecting mental health. So let's get into it real quick. So this study that came out, and I'm going to have it in the show notes for you to take a look at if you want. Basically, the authors of the study, and I quote here, "It is important that people know that the idea that depression results from a chemical imbalance is hypothetical, and we do not understand what temporarily elevating serotonin or other biochemical changes produced by antidepressants do to the brain. We conclude that it is impossible to say that taking SSRI antidepressants is worthwhile or even completely safe." Bombshell, boom, head exploding, all right? So now for all you people, 1 in 6 of you are taking these things anyway, so I'm not going to sit here and say that it's time to throw your antidepressants in the trash can, okay? We don't do that. We never quit a medication cold turkey. We never quit a medication or start a medication without talking to our provider about it, okay? Best practice right there. But what we do need to really think deeply about now is why we're taking this medication and what exactly it is doing for us. All right. So we cannot talk about, and now let's walk it back here a little bit. So I want to talk about depression itself. Depression itself is defined in the Diagnostic and Statistical Manual of Mental Health Disorders as being a persistent, and by persistent we mean over 6 months of occurrence. And if something is diagnosable for us, meaning the medical community or the mental health community, this has to be persisting. This condition has to be persisting greater than 6 months, or right at 6 months, or roughly 5 out of 7 days a week. So 5 out of 7 days a week, you feel not good. You feel worse rather than better. You feel sad, and or that things are not going your way. You don't feel motivated. Things that you used to be enjoying in your life and have enthusiasm for, you no longer have that. Okay. This is not a temporary result of the SADS. It is not that you had a bad few days, or you had a fight with your boyfriend or your girlfriend and you are depressed about it. You're depressed about your relationship. Okay. It's an overarching feeling of being unmotivated and being generally down in every area of your life: work, school, home, relationships, friendships, socially, etc. Okay, so physical manifestations of this can look like sleeping too little, sleeping too much, eating not enough, eating too much, significant weight loss, significant weight gain. Are you seeing a pattern here? Are you seeing a pattern of a little bit of ambiguity? Because everybody is a special snowflake. Depression can show up in a lot of different ways. All right, irritability is also a sign of depression. So if you're angry kitty all the time, if you are just, kind of like pissed off all the time, irritability is also a sign of depression. Well, in this day and age, and for our times of recession, and when we have a government right now that is telling us that things are happening that aren't, when we can see with our own two eyes that a recession actually is happening, but we're just going to go ahead and redefine what that means. And our expenses have gone through the roof. We can't go fill up our gas tank or get groceries at the grocery store without having to sell a kidney. Well, then how can you not feel a little depressed? How can you not feel that things are not going the way that you want them to? Okay. But is that a reason to go to your provider and request an antidepressant? And y'all, that is what's happening, because listen to this study right here, or to these kind of stats. Studies suggest that many people who don't need antidepressants are getting access to them. All right, what does that mean? You can go to your doctor, you go to your provider and say, I'm feeling kind of depressed, and boom, he or she may flip you a prescription for Prozac or Lexapro or something on request, though not diagnose you with depression. Okay, so a study done from 1996 to 2007, it was found that the proportion of visits at which antidepressants were prescribed, but patients were not diagnosed with a mental health disorder, increased from 59.5% to 72.7%. So even though you don't meet the clinical threshold for depression, these providers were just giving you the prescription anyway. Okay, so it says, in recent years, antidepressants have been heavily used to treat a variety of mental health disorders or health conditions besides depression, such as anxiety, insomnia, ADHD, and chronic pain. This is alarming, as we are still unsure of whether or not antidepressants can be effective in treating such diagnoses. According to Dr. Robin Tamblyn, a professor of epidemiology and biostatistics at McGill University, the thing that's of concern here is that when prescribing for conditions other than depression, it's unknown whether the drug is going to be effective because it's never been studied, she continues. These doctors are prescribing in the dark. Oh my, right? So what does that mean exactly? And why in the world would these doctors go ahead and prescribe something that they're not even sure if it works? All right. Now, I'm not about to sit here and say that the medical profession is a protracted guessing game of diagnoses and medications, though there are some in my field that may say that it is. Okay. But at the same time, here's what doctors and mental health professionals do understand. And that, my friends, is the placebo effect. Okay. Now, if you've been around for a while, or if you've ever taken a science class, you probably know about the placebo effect. The placebo effects can be defined basically in the idea of a sugar pill. Basically, so you're doing a study, you give the real medication to a group of people, and you give a sugar pill or a fake medication to another set of people, but the people don't know what they're getting. They don't know if they're getting the real medication or if they're getting the fake medication or the sugar pill. And then they have to talk about their symptoms and what they're feeling, and do they feel better as a result of taking the medication. So basically, here's what was found, that when people are told, hey, you're taking this medication and it's supposed to improve your mood, even if they took the sugar pill, 80% of people say they feel better. 80%. That's major, y'all. That's major. And I joke sometimes in my sessions because I tell people, well, if it makes you feel better, then there you go. I don't care if it's Tic Tacs that make you feel better. If you pop a couple of Tic Tacs and you feel better, well, then great, right? Because the placebo effect is in effect all the time. Our mind and our brains are so powerful about how we think and how we feel and how we behave that if we think we're going to feel better, basically we will. Now, this is not a plug for positive psychology. It is not a cure-all, end-all, be-all for the therapeutic profession. Because, y'all, trauma is real. PTSD is real. The anxiety is real. All right. I'm not minimizing anybody's symptoms or diagnosis with my talk here. But what I'm saying is that when you go in and you tell your provider that you are feeling depressed or you are anxious or you can't focus, and that provider then flips you a prescription for an ADD medicine, an ADHD medicine, an anti-anxiety medicine, or an antidepressant medicine. 80% of the time, when you take that, you're going to tell yourself you feel better, that you're doing better, that your productivity has improved, that things are good because, you're popping this pill now. So what does that really say about how people are being diagnosed, how people are being prescribed, and how we're looking at mental health in this country? My perspective is I am not pro-medication. I am not anti-medication. All right. If someone thinks that a certain medication will make a huge difference in their life or make them feel better, then I would look into it. I would talk to your provider about it. And/or I would talk to a psychiatrist about it. I would be very suspect of any provider who randomly said on request, here's an antidepressant, here you go, see how it goes. Because it would be my bet that that provider would be banking on the placebo effect, that you're going to feel better. Because y'all, it's all self-report anyway, all right? If you say you feel better, I can only take you at your word in a mental health session as to how you feel or what you're doing. It's self-report, all right? We don't have a blood test, or we don't have any kind of real test that can say what your mood is like. All right, you have to tell us. So if you think you feel better, you probably do. That's how it goes. All right. So the counseling profession has, and what we're trained to tell people, or what we're trained to approach meds and therapy, we're trained to approach it as a 1-2 punch. And here's what I mean by that. All right. In my practice, I take what's called the biopsychosocial approach. I'm going to look at your body, what you're doing health-wise, how many medical problems you do or don't have. I'm going to take your mental health into concern, what you're dealing with at home, at work, at school, and in your relationships and socially. And I am going to, in the social part, do you have any friends? That's the bottom line for the social part. Do you have any friends? Biopsychosocial is what we're talking about here. And if you are in a flat spin of trauma, sleeplessness, and you are suffering and tortured, there may be some medications out there for you that can take the edge off. All right. And by taking the edge off, I mean things like benzos, things like hydroxyzine, things like, and again, I'm not prescribing, I don't even have prescribing capability here, but that is a class of drugs that will help you go to sleep and that will keep you from being so anxious. These are class 2 substances, meaning that they are highly addictive. All right. So we don't stay on these for very long. All right. 30 days at the most is how most providers prescribe benzos, because they are highly, highly addictive. And even though they take the edge off and they help you sleep and they help you kind of not suffer and obsess so much about whatever has happened, because it's usually in response to a big trauma or a big event that's happened in your life, these benzos are actually used long-term. Benzodiazepines will make you more anxious in the end. So they actually have the opposite effect for what they're supposed to do to begin with, ironically enough. Yes. All right. So you have to be very, very careful with these medications. Okay. What we're trained to do and how we're trained to approach medication in the mental health field is that we don't do any mental health medication without therapy. All right. Because think about it this way, folks. If it were a simple medication that would be a game changer and would just make you feel better, and then it would be like flipping a switch, well, everybody would be on pills, I would be out of a business, and I'd be popping the pills too, because you know what, why not? But it's not that simple. All right. Taking a medication, it might take the edge off, it might help you to focus a little bit. But if you don't have the skill set and the tools and the coping mechanism and the skills and the strategies in order to move your life forward in a more productive way, in a more logical way, in a more reasoned way, and keep check on your emotions, if you don't have those skills, then why are we taking the pill? What are we doing? What are we doing? Now, I know that 1 out of 6 people in this country who are taking meds are also not in therapy. I know that's not happening. My caseload is busting at the seams, but I know it's not to that level, because quite frankly, if you are, and I'm going to say this public service announcement right now, if you are on an antidepressant or some sort of psychotropic mental health medication, you need to be in therapy. Because the idea is not to stay on this medication forever. The idea is to stay on this medication for a little while and eventually get off of it. Now, we know that the drug companies would love to have you taking this medication for the rest of your life, right? You need your happy pill, you say, and you're going to take it, and that is, what needs to happen. Well, but that's not the idea. What I propose to my clients, because a lot of my clients, admittedly, they do not like to be on any kind of medication, or if they are, the idea is to get off as soon as possible. What I tell my clients is, let's stay on this medication for 6 months. Let's see how we're doing after 6 months. And then we will maybe attempt to come off of it if that's what you want to do. I don't encourage dependency on medication, dependency on anything for that matter, right? We don't want to have dependency on a medication. But if we feel that we need it, then I would say let's do a trial balloon for 6 months and see how we do. A lot of times, I really think that folks don't necessarily feel that much better, but they feel the side effects from the medication, and so they think it's working. And there are lots of side effects. There are lots of side effects. I don't think that, I think it's kind of by design in a way. I think most medication does have a side effect of some sort. And I'm not here to piss anybody off in the medical or drug field. Again, my 2 cents. But at the same time, staying on these medications for life, not advisable. I would like for nobody to have to be dependent on medications for life. If you're on medication and you're not getting therapy, seek out a therapist straight away, okay? In my practice, because I take that biopsychosocial approach, all right, we're not going to talk about your feelings for every single session, and we're not going to I'm not going to love you better, all right? I would love, if that would work, that would be awesome, but I can't do that, right? So a lot of times I encourage my folks, what are you doing to get moving? We want your body to be its own fountain of feel-good chemicals. And what do we know can do that? Exercise, moving, walking. We want to go further than that. Yoga, jujitsu, any of the martial arts, right? So anytime you get moving, you oxygenate your cells and you get fresh air into your lungs, you are automatically beefing up the naturally produced serotonin or dopamine in your body. All right. If you're hanging out on the couch and can't get out of bed, right, then you're not going to feel good. You're just not. There's no way you can if you can't get off the couch. All right. So all this to say, in my practice, I encourage people, get moving. You have got to move your body if you want to start to feel better. The third thing, diet. Diet is huge, y'all. And if you eat like crap, you're going to feel like crap. Period. Now, I'm not saying you have to go Whole30. I'm not saying that you have to be clean and keto. Yet, if you have some weight to lose, now might be the time. If you are, stuck in the McDonald's drive-thru, or the bane of my existence, Chick-fil-A. I do love me some Chick-fil-A, but we know it's not good for you, right? It's still fast food, even though it tastes amazing. It's time to clean it up, y'all. And the minute you start cleaning up, that diet, you're going to start to feel better. All right. So 3 things. If you're on that medication, go get some therapy. If you don't want to take medication, get some therapy. Get some therapy first, and then help and work with your therapist to determine, do we really need medication, or can we pull ourselves out of this? That's what CBT is, cognitive behavioral therapy. This is the gold standard that is used to treat anxiety and depression, and it talks about examining your thoughts and how we can change them, okay? So go to therapy first, then think about meds, not the other way around. But if you do it the other way around, go get some therapy too, okay? Get moving. Get your diet in check, all right? Because it's probably gone off the rails. You drinking too much? Are you? Drinking too much soda? Putting too many chemicals in your body? Right? I'm asking. The threshold for substance abuse with alcohol, substance use disorder, alcohol is actually really, really low. Look it up, y'all. Look it up. If you're in the mommy wine culture and you're popping open a bottle of wine every night and killing it, yeah, you might have a little problem. You might have a little problem. I know. 2 to 4 glasses every night. A little bit more on the weekends. Yeah. Might need to rein that in. Just saying. All right. Substance use disorder thresholds, the number of drinks per week is actually quite low. Look it up. All right. I know it's just wine. I know it's just 1 or 2 glasses, and you deserve it at the end of the day, don't ya? But you gotta check that. You gotta watch that. That might be contributing to your depression too. So getting in that therapist's office can really help you uncover maybe what might be driving the depressive thoughts, the loss of motivation, or the weight gain, the weight loss, the loss of appetite, the loss of interest. Let's figure that out first before we just start popping pills, shall we? All right, y'all. Hug your babies. And have a great weekend. And this is The Right Therapist, a division of The Conservative Take. Thank you to Kyle and all the gang for tolerating me and letting me come on and be the right therapist for you. Would love to hear from you. Comments and questions below. Y'all stay cool this summer and have a great rest of the day.